All right, future L&D nurses, welcome. So you're about to start your labor and delivery rotation. This is for you. Think of this as your essential guide to hitting the ground running. We're going to get you totally prepped for what is, honestly, one of the most exciting clinicals in all of nursing school.
So let's start with the big one, right? How do you care for two patients at once? This is the question you're going to live and breathe in L&D. You're not just looking after one person. You're responsible for two lives that are completely connected. Every single thing you do, every vital sign, every assessment has to take this incredible partnership into account. It's a huge deal, for sure. And we're about to break down exactly what you need to focus on to nail it. Okay, so here's our game plan. We're going to walk through this just like it happens in a real clinical shift. We'll start with assessing both mom and baby, then we'll look at how to track labor's progress. After that, it's all about the newborn. That first head-to-toe check, the meds and measurements, and finally, something just as important, teaching the new parents.
All right, let's dive in. First things first. When you get on the unit, your absolute top priority is getting a clear, real-time picture of both of your patients. I can't stress this enough. The info you gather in these first few moments, that's your roadmap. It's going to guide every single decision you make from here on out. Okay, let's talk about the baby. The single most important piece of information you have during labor is the fetal heart rate, or FHR. Why? Because it tells you right now how well that baby is handling the stress of labor. And even more critically, it's our best clue to know if they're getting enough oxygen. Now, this is where you really learn to read the baby. Seriously, this heart rate strip is telling you a story. Look on the left. Those are all good signs, what we call reassuring. A nice steady baseline, some healthy little wiggles called moderate variability, and those upward jumps, accelerations, that's a happy, well-oxygenated baby. But then look at the right. These are the concerning signs, the ones that make us sit up and act fast. Late decelerations can mean there's an issue with the placenta. Variable decelerations often point to the cord being compressed. See? These aren't just random squiggles on a screen. It's the baby communicating with you.
Okay, so let's shift gears to our other patient, mom. We have to talk about contractions because they are literally the engine driving this whole process. You need to know three things. How often are they coming? That's frequency. How long do they last? That's duration. And how strong are they? That's intensity. This pattern is everything. It tells us how labor is moving along and how it's impacting the baby.
And here's a super practical, low-tech skill you're going to use all the time. You don't always need a machine to know how strong a contraction is. You can just use your hands. So a mild one feels like the tip of your nose. Go on, touch it. A moderate one feels like your chin, a little firmer, right? And a strong one, that feels like your forehead, rock solid. Seriously, try it right now. It's a fantastic little trick to lock this in your brain.
Okay, so we've got our baseline on mom and baby. We know what's going on right now. The next question everyone wants to know is, so, how close are we? Well, these next assessments are exactly how we figure that out.
The most direct way to track progress is with a cervical assessment. It's an internal exam, and you're checking for three specific things. First, dilation, that's how open the cervix is. Second, effacement, that's how much it's thinned out. And third, station, which tells us how far down the baby's head is.
For dilation, 10 centimeters is the magic number. That means the cervix is fully open, it's out of the way, and it's time to get ready to push. For effacement, we're looking for 100%. That means the cervix has gone from being thick, kind of like a cone, to basically paper thin, making way for the baby.
And for station, a plus number means the baby's head is coming down. When we get to +3, that means you can see the baby's head. That's crowning. And delivery is happening like right now. Okay, this next one is a huge deal. Have her membranes ruptured or not? Basically, has her water broken? If they're intact, the baby is safe inside a sealed, sterile little bubble. But the second they rupture, that barrier is gone. You have to note the exact time this happens, and even more importantly, the color of the fluid. Clear is good, that's normal. But if you see green or brown fluid, that's meconium. It can be a sign of fetal distress, and it means we need to pay very close attention.
And then, in a single moment, everything changes. The baby is here. Your entire focus pivots. In these first few minutes of life, your job is to do a quick but thorough assessment to make sure this little one is adjusting okay to life on the outside.
Think of this as your very first conversation with this new person. You're using your eyes, your hands, your stethoscope to check everything from head to toe.
What's their skin color look like? Are they nice and pink? You'll feel their head. Are those soft spots flat? Watch their chest. Is it moving symmetrically? You'll check their abdomen, count all their fingers and toes, and then you'll check their reflexes. The moro or startle reflex, rooting, sucking. This isn't just a checklist, you guys. It's your first chance to spot any big issues right away.
So why are we so obsessed with these reflexes? You know, the startle reflex or the rooting reflex? It's because they're a direct window into the baby's brain and nervous system. When those reflexes are present and strong, it tells us the central nervous system is working the way it should be. If a reflex is weak or missing altogether, that's a red flag. That tells us we need to look closer.
Okay, so the initial assessment is done. Baby is stable and doing well. Now we move on to a couple of standard procedures that are super important for setting them up for a healthy start. We're talking about a few key meds and getting those first all-important measurements. You're going to see these 3 medications given to pretty much every newborn, and for good reason. First, the vitamin K shot. Babies are born with low levels of it, and this shot prevents serious bleeding. Then there's the erythromycin eye ointment. This protects their eyes from any bacteria they might have picked up in the birth canal. And finally, the hepatitis B vaccine, which is just the first step in protecting them from that virus. It's all about proactive, preventative care from minute 1.
Next up, we need to get an accurate weight, length, and head circumference. And trust me, this is non-negotiable. These numbers are way more than just something cute for the baby book. They are the critical baseline. Every single measurement from here on out, every dot on a growth chart is going to be compared back to these very first numbers. They're that important for tracking a baby's health.
All right, so the most intense clinical tasks are done. But now, one of your most important jobs is just beginning, being an educator. I mean it. Your ability to teach new parents in a way that's calm and clear is just as vital as any other nursing skill you have. You're literally empowering them to go home feeling safe and confident. So what do you need to cover? Think of it as the big 4. First, safe sleep. This is huge. Back to sleep, firm mattress, nothing else in the crib. Second, feeding. You'll help them with whatever they choose, breast or formula. Third, cord care. Super simple. Just keep it clean and dry. And fourth, and this is so important, the warning signs. You have to teach them when to call the doctor for a fever, for jaundice, if the baby isn't eating well. This teaching is what makes the difference between a panicked parent and a prepared parent. Okay, before we wrap up, I want to leave you with a core principle of safe nursing practice. And it sounds simple, but I promise you it's one of the most important habits you will ever develop. In an environment like L&D, which can get crazy fast, you must always verify orders before you give any medication to either patient. Double-check everything. That simple habit will protect you, and it will protect them. Wow, okay, we've covered a ton of ground, right? From reading a fetal heart strip all the way to teaching safe sleep. So as you get ready to walk onto that unit for the first time, I want you to think about this. Which one of these skills are you going to practice first? What's your day 1 goal? Having a clear focus is going to make all the difference. You're going to do great. Good luck.